Mr. Speaker, as you are well aware, I'm rising again, as I have on many occasions in the past, to raise the issue of mental health for Canadians. And this government's failure to follow through on its commitments, again, I'm flagging that, Mr. Speaker, because mental health is health. Back on October 7th, I asked the minister why the Liberals were abandoning their promise to make mental health a full and equal part of Canada's universal public health care system. And at the time, I indicated it is estimated that every dollar invested in mental health generates $2 in long-term savings, while untreated mental health issues cost our economy more than $50 billion every year. Well, first of all, Mr. Speaker, I need to correct the record right now. That $50 billion figure, that was from 2012. A new report released earlier this year by the Mental Health Commission of Canada estimates that the monetary costs associated with untreated mental health issues is actually more like $200 billion. That's an increase of $150 billion over 13 years. Now, I asked the Minister of Health to acknowledge that it's time to invest in the mental health of Canadians as a nation-building project. The response I received during question period, and I'm being quite generous here, was woefully disappointing. She said that mental health is top of mind of this new government. We actually don't see that reality reflected in actual investment dollars in the past budget, apart from some funding for youth mental health that the NDP helped advocate for. But again, Mr. Speaker, they made commitments in their 2025 election campaign that they would make the Youth Mental Health Fund permanent and earmark $150 million per year towards it, beginning this year and continuing through fiscal year 2028-29, which they failed to do. So what happened to these great ideas between the recent federal election and this budget? Even the government followed through on its campaign. Even if the government followed through on its campaigns, these figures are woefully inadequate, and they fall far short of meeting the $200 billion in annual costs to the Canadian economy resulting from untreated mental health issues, as I stated earlier. If the government is actually serious about improving productivity in this country, we need to double investments in mental health. We need to support, Mr. Speaker, workers, especially when we look at nation building. Investing in mental health is nation building. It does help support the GDP. We're only spending about half of what our peer countries do on mental health when we look at the OECD average, and we're seeing the results of that underfunding. Just go outside and you can see the impact, Mr. Speaker. Every family in this country is touched by someone struggling with mental health issues. Mental health funding is an investment in Canada's workforce, and while the Youth Mental Health Fund is an important investment, we need to ensure all Canadians can access appropriate supports. Data published by the Canadian Institute for Health Information just last month found that in 2024, 41% of Canadian adults and 36% of children who needed mental health care had needs that were only partially met or were completely unmet. That shows we have a long way to go. And as Canadians, we pride ourselves in taking care of each other, but right now too many people are being left to struggle on their own. It's time to change that. It's time to finally bring mental health into our universal public health care system. That's why I tabled the first private member's bill in the 45th Parliament, Mr. Speaker, Bill C-201. If that was passed, that bill, it would bring community-based mental health services into the Canada Health Act so that we have parity, Mr. Speaker, and all Canadians would access supports with a health card, not a credit card. Mr. Speaker, my question to the Minister and the Parliamentary Secretary is to commit here and now to fixing the Canada Health Act to ensure we have parity with mental and physical health and make sure it's implemented in our universal public health care system.
The Honourable Parliamentary Secretary to the Minister of Health.
Mr. Speaker, I want to begin by sincerely thanking my honourable colleague for this very important question. I have tremendous respect for his work on mental health and for the work that he does on behalf of his constituents. His commitment to this issue elevates our conversation in this House, and I'm grateful for his leadership.